Okay, I think I'm live. Hi, everybody. I'm just going to wait for a few people to get on before I start answering some of your questions.
Good afternoon, ladies and gentlemen. Thank you for joining us this afternoon. I appreciate the leadership and support of the President.
Okay, so one question that did come through was about CoolSculpting and basically who is a good candidate for CoolSculpting. We do quite a bit of CoolSculpting here at West County Plastic Surgeons. And the nice thing about our office is that it also includes board certified plastic surgeons, myself and Dr. McCatton. I think that it's important when you are considering CoolSculpting to be evaluated by somebody who has multiple tools in their toolbox, so they can treat you with multiple modalities and really just decide what is the best option for you, taking into account your anatomy as well as your goals and concerns. And then also what potentially is most important is what is your budget and what is your downtime, what is your ability for downtime, et cetera. So who's a good candidate for CoolSculpting? The truth is almost everyone is a candidate for CoolSculpting in some form. So if you have an excess area of fat or fatty tissue somewhere, we can treat that with CoolSculpting. Now, the trick is figuring out whether or not being treated with CoolSculpting is going to actually meet your goals or your needs. And that's where it's really important to be evaluated by experienced people who do a lot of CoolSculpting, as well as liposuction, as well as body contouring, like an abdominoplasty. So let's talk about the abdomen, for example. If you're somebody who says, gosh, I have this extra tissue or this extra fat in my abdomen, I wonder if I'm a candidate for CoolSculpting. What we're looking at when we're evaluating you is how much excess fat is in that area, as well as what kind of excess skin do you have, and what is the quality of that skin. So for example, some patients may feel they have a lot of fat in their abdomen or a pooch, and when we evaluate you, we find that actually you have quite a bit of skin excess, and by deflating the fat in that area, you may actually feel like it's worse because now the skin could potentially be even more lax or appear more saggy. And so that's where it's important to counsel you that, you might actually be a little bit more happy with an abdominoplasty or a tummy tuck. And even if a tummy tuck isn't something that you want to do, at least you won't waste your time and money doing fat reduction like CoolSculpting or liposuction. So the short answer is almost everyone is a candidate for CoolSculpting, but the longer, better answer is you should be evaluated by a really trained professional, especially an office that has board certified plastic surgeons who can also offer other modalities such as liposuction and body contouring type procedures. So that is hi guys, so that is the longer answer. If you have any questions about CoolSculpting, then of course we are always happy to evaluate you in our office to see whether or not that is something that can suit your goals. Okay, if there's no other live questions right now, so let me just go to some of these others. So how often, or no, let's do this one. Is there a way to remove under eye bags without any visible scars? So that is a great question. So there's a couple of ways to think about this. So visible scars could mean surgery, but where the scars are hidden, or it could mean non-surgical. So again, similar to the CoolSculpt evaluation, it's really, really important to be evaluated by a board certified plastic surgeon who has a lot of tools in their toolbox, meaning they are not a one size fits all type shop. They can look at your anatomy. So when somebody comes in complaining of bags under their eyelids here, it's normal to have fat in the lower eyelid. That's a normal, natural part of everyone's anatomy. What can cause bags under the eyes are a few things. Sometimes that fat can actually be a bit excess, so having a bit more fat than normal. Or sometimes over time, the tissues around the fat can start to weaken, causing herniation of the fat or loss of support of that fat. So it can give the look of a fat bag. And then also sometimes the fat can start to droop, just like other fat in our face can begin to go south. When this fat starts to go south, it can uncover some of that area under the lower eyelid and give that appearance of bags. Also, some people, again, usually as you age, the skin of the lower eyelids can become more lax, and that can give the appearance of a bag. So having somebody evaluate you to really look at what the anatomy is and what is causing the problem that you're concerned about is really important. So for somebody who maybe is on the younger side and their skin quality, it's not very lax, it's actually nice and firm, but maybe they have a bit of excess fat. And this could be a congenital issue. Maybe your parents looked just like that. There are some surgeries that can be done through the inside of the eyelid. So again, no visible scar. It's on the inside of the eyelid where that fat can be sometimes partially removed and also often more beneficial repositioned. So we often talk about this hollow right here, which a lot of us have, and will complain of a dark circle or a bag. Sometimes repositioning some of that fat from where it seems to be herniating into that area can give a nice softening. So that surgical approach, that could be no visible scar. Now that's not a great approach for somebody who has a lot of skin excess and really needs some skin tightening. People who need some skin tightening, the scar typically is going to go right under the eyelash line and then off to the side. Now, often this heals beautifully and it's very difficult to see it over time, but it is a scar that is on the outside of the eyelid. So that's something to discuss with your surgeon. This type of procedure also takes a little bit longer to heal and kind of be able to get back to social activities like where you're confident that people won't really know that you've done anything. So that's going to take a little bit longer. Now, the other side to think about are some non-surgical choices. So this is going to fall into kind of two camps. We don't really do a lot of fat reduction non-surgically in this area. At least I don't recommend it. A lot of you maybe have heard of things that can melt fat like Kybella. I don't recommend using that around the eyes. I think it's a bit too risky. But we can do things to, number one, tighten the skin of the lower eyelids. There's two main ways, or actually three main ways we can do that. The first is with true skin tightening devices such as Ultherapy. Ultherapy is ultrasound technology, and it's my favorite technology. There are also radiofrequency technologies that can tighten the skin as well. I don't like those as well as the ultrasound, but those exist. That can help tighten the outer layer of skin, which is helping kind of hold that fat herniation at bay, giving the skin a better, tighter quality. The other issue is to camouflage those bags with some injectable filler products like hyaluronic acid filler products. So again, you can get a little fat herniation, and then underneath that you can get a little hollow. We sometimes refer to that as a tear trough. Think of it like when you cry and the tear gets stuck in that little hollow. So that can be filled in a bit with filler. I had that done yesterday. If you guys can see my lower eyelids, I just had some tear trough filler done yesterday. I do it about once a year or so to keep that kind of looking a bit smoother. It can also, again, help decrease the feeling like you have a dark circle there. So the bag, it's camouflaging the quote bag, but it's also camouflaging that dark circle, because often what is contributing to the dark circle is actually a shadow. So if you can improve the contour, you don't have the same shadowing there. Finally, there are some treatments to the skin, which target the outside of the skin in, like laser resurfacing or microneedling, which can stimulate collagen formation and elastin reorganization in the deeper layers of the skin, and can help thicken the skin, which helps tighten the skin. All of these things are going to, again, improve the appearance of those under eye bags or under eye hollows. And again, I'm going to say this 100 times. It's really important to be evaluated by really experienced providers, such as a board certified plastic surgeon, to really understand your options. And although you may have multiple options, it's important to determine which of those options are going to best suit your goals which include how much downtime do you have, are you willing to have surgery or not willing to have surgery, and then finally, how much of an improvement are you looking for, a subtle improvement versus a more dramatic improvement. The more dramatic improvements are often, we're going to recommend more surgical approaches rather than the non-surgical approaches. Let me just see here. So hopefully I answered that pretty well. Hi guys. If you guys have any questions, go ahead and feel free to ask them right here on the post. Otherwise, I'm gonna get to another question that came in on Messenger. How often do breast implants need to be replaced? Again, really important question, and it's a really common question. I think a lot of people are used to hearing the rule every 10 years, replace your implants. Certainly replacing your implants every 10 years is not wrong. You certainly could replace your implants every 10 years and most likely you'd be in great shape. However, the implants nowadays are great technology. Every several years we get newer and newer implants, and the technology is just getting better and better. So right now, our current silicone implants, we have a couple of choices in silicone implants, and they vary in degrees of how cohesive they are or how solid they are. So cohesivity is a measurement of how solid something is. So maybe some of you have heard of gummy bear breast implants. That's referring to a more cohesive implant or more solid implant. These implants are very sturdy and in my opinion are going to last typically much longer than 10, 15, 20, even 25 years. That being said, most women with these types of implants, and even nowadays, the reason that women are coming back for a revision of their breast augmentation may not necessarily be because anything is wrong with the implant itself. So for example, other reasons that women could come back for a revision of their breast augmentation include things like scar tissue around the implant called capsular contracture, where the tissue and the breast and the implant start becoming very firm and even uncomfortable. That firmness can be a very slight firmness to the touch, but it could progress and become more firm, causing pain or even displacement of the implant, sometimes higher on the chest wall where it looks like the implant is moving north. Really, that's that scar tissue inside contracting. Luckily, again, with our techniques for breast augmentation have gotten a lot more sophisticated and refined, as well as the implants themselves, we're seeing a lot less capsular contracture. We see higher rates of capsular contracture when implants are ruptured, when implants are placed through incisions other than the crease of the breast. So for example, incisions around the areola, those incisions we know leads to a higher risk of capsular contracture. Women who had bleeding around the time of their augmentation or infections around the time of their augmentation lead to higher risk. But luckily, again, those rates are going down, but that could be something that brings you back for a revision of your augmentation. Another issue could be malposition of the implant. So again, aging over time, sometimes the implants shift or move. They might be too low, they might be going too far laterally, like towards the armpit area. And so a revision where the implants need to be repositioned is another common reason somebody may come back. And that could happen at 2 years, that could happen at 20 years. Finally, the breast tissue itself is going to continue to age. And this is a factor of the size of your breast as well as the quality of the tissue. So a larger, heavier breast is going to age and sag over time. So for example, the breast implant may still be in a good position, but the breast tissue has started to age or fall off of the implant. So this may be somebody who comes back to have a revision and we do a breast lift as well as replace or reposition implants. And so that's another reason why women come back for a revision. But as far as just simply the age of the implant and replacing it potentially before there's any problem, I think 10 years is reasonable, but it's a bit conservative in my opinion. If you're doing great and there are no issues, the implant is not ruptured, it's still in a good position, and you haven't had any aging of the tissue off of the implant, then I think you could potentially stretch that a bit longer, especially with these newer implants. So it's never wrong, but you could potentially get away with a bit longer. Do you guys have any other questions for me this week? I'm going to try to do this every week and answer your questions as they come in, but also probably pick a topic that I'm just going to discuss. So for example, next week, I may go ahead and elaborate on breast augmentation and talk a bit more about different types of implants. We can talk about the surgery process, how we decide on implants for you as a patient, and what your recovery, even be able to get some patients to give kind of their story on their recovery and what how things kind of did or didn't meet their expectations, what they expected with recovery, and kind of longer term. So I'm going to talk about that next week. But if there are any other questions that come in, I am happy to answer those as well. So this has been really fun. Thank you all who joined. Really exciting, and I will see you next week.